good evening, viewers. We come to you from the city of Agra. From this Monday, our Covid Dispatch will roll out of the state of Uttar Pradesh in the grips of the second wave where the coronavirus cases are concerned. We come to you from Agra. We're going to get you the very latest in terms of where this city stands, where the Covid crisis is concerned. But this report comes from the city of Kanpur, where, of course, during the first wave, it seemed that the villages, the rural belt, had escaped it pretty much. But the second wave tells a very different story.
Overburdened hospitals are struggling to cope in cities due to a lack of resources and a huge influx of patients. But it's not just cities. Rural areas are also struggling. There may be lesser patients, but basic health care isn't available. This is Jahangirabad, a small village in Uttar Pradesh's Kanpur, and the plight of the villagers here will shock you. Locals tell us that in the last 20 days, about 25 to 30 people have died. All of them showed COVID symptoms and had breathing trouble, but received no help.
कई लोग हमारे यहाँ से खत्म हो चुके हैं और यहाँ पर कोई सुविधा नहीं मिल पा रही है। ऑक्सीजन वगैरह नहीं मिल पाता है। जाते हैं हम लोग अस्पताल में तो दवा इलाज हमारा कायदे से नहीं होता है।
अगर यहाँ पर इतनी सुविधा होती तो ये मौतें इतनी ना होती। एक लोग को ले जाओ और इसके बाद लौट के ना आओ, 4 आदमी फिर खत्म हो गए। अगर किसी अस्पताल ले जाओ तो वहाँ कहीं कोरोना की जांच कराओ, कहीं ये कराओ, कोई भर्ती नहीं करता। ये हाल है यहाँ का।
प्रशासन के द्वारा कोई भी यहाँ सहायता नहीं मिल पाती है, जबकि ये नेशनल हाईवे 86 है। इसी रास्ते से हमारे यहाँ तहसील मुख्यालय के तमाम अधिकारी निकलते हैं, लेकिन कोई भी ध्यान नहीं देता। आज तक हमारे गाँव में सैनिटाइजर नहीं हुआ है, जबकि विधायक जी हर गाँव में जाते हैं और यहाँ तक नहीं आते हैं विधायक जी के यहाँ भी सैनिटाइजेशन कराया जा सके।
अभी एक आदमी सुभाष पांडे मर गया, बुखार आया, इंजेक्शन लगवाया, मर गया 2 रोज बाद बुखार में। तो यहाँ इंजेक्शन नहीं लगवा रहे हैं डर की वजह से। डर लग रहा है कि बुखार ना आ जाए, मर ना जाए, फूड नहीं कर रहा है।
Some of them made it to hospitals. Even they couldn't be saved due to the oxygen crisis.
ये हमारे चाचा जी थे, शीतला साई खरे इनका नाम था। बेसिकली इनको प्रॉब्लम अस्थमा की पहले से रही है, सांस लेने में दिक्कत, लेकिन अभी इस बीच में सांस की प्रॉब्लम हुई। ऑक्सीजन सिलेंडर कानपुर में कहीं पर भी नहीं अरेंज हुआ। घाटमपुर से इनका अरेंजमेंट किया गया, घाटमपुर से इनको सिलेंडर दिलाया गया। फिर कानपुर ले गए तो वहाँ पर डॉक्टर टहलाते रहे कि आप यहाँ ले जाइए, वहाँ ले जाइए। फिर लौट के घर पे आए। घर पे लाने के बाद ये शाम को सही रहे, ऑक्सीजन सिलेंडर जब हटाया गया है, और मॉर्निंग में वही 5:40 पे ही खत्म हो गया।
There are 0 healthcare facilities here. Even the primary healthcare center set up to help this village with 6,000 odd people is shut down.
ये पूरा स्वास्थ्य केंद्र इस वक्त खंडहर बन चुका है और यहाँ पर किसी भी तरीके से कोई भी व्यवस्था नहीं दी जाती है। यहाँ स्वास्थ्य केंद्र पर ताला लगा हुआ है और यहाँ लिखा हुआ है स्वास्थ्य केंद्र जहांगीराबाद। सीधे तौर पर यह बताता है कि स्वास्थ्य केंद्र गांव के अंदर मौजूद है, लेकिन इस गांव में पिछले 20 से 25 दिनों के अंदर जिस तरीके से यहाँ मौतें हुई हैं, करीब 25 से 30 लोगों की मौत हुई है, वैसे में यहाँ का हाल देखिए। और ये हाल इतना खतरनाक है कि यहाँ सिर्फ और सिर्फ गंदगी भरी हुई है। पूरा स्वास्थ्य केंद्र इस वक्त खंडहर में तब्दील है। गांव में इस तरीके की स्वास्थ्य सुविधाएं जो होनी चाहिए वो किसी भी तरीके की नहीं है।
Many of these villagers have coronavirus symptoms themselves, but have no way of being diagnosed of the virus. Why? Because there isn't a single testing facility available in these areas. Bureau Report, India Today.
All right, viewers, this is the situation right now in Kanpur. Things none the better where Agra is concerned. I myself went to many villages today, completely helpless. There are no, district hospitals to even take care of those where the rural belt is concerned. We're going to continue to tell those stories, but let's get back to the national capital. If you're sure that you've got yourself registered on the Covid app, you've booked yourself a slot on a particular date, you will get vaccinated on that date. Well, this is a horror story coming in from one of the centres in NCR, Delhi.
Bipasha had a vaccine slot booked for 10th May, 3 to 5 p.m. When she reached, she was given a gate pass to enter. But then inside, when her turn came, she was denied a shot. Not because the vaccine was in short supply, because her name and registration did not show up in their co-win appointment list.
And I got my entire application, appointment, SMS verification code from COVID app. Despite that, the authorities and the vaccination people over here refused to give me any vaccine, saying that it's not possible as it's not showing in their appointment portal, which is also administered by COVID.
Mistake तो नहीं है मैम.
But there is a somehow my name got slipped despite me getting everything and doing it through the proper channels.
जी मैम. क्या करें सोल्यूशन मैम आप बता दीजिए.
Solution तो मेरे हाथ में नहीं होगा ना. आप लोग medical officers, so you are the people who are responsible for all of this. Solution आप लोगों को निकालना होगा, नहीं तो हम तो यही बोलेंगे कि medical officers don't have solution and there is a problem, people are facing problem.
मैम मेरे हाथ में इतना नहीं है क्योंकि पोर्टल पर जो अधिकारी ऊपर से करते हैं वही तो.
ये अधिकारी कौन है? कौन ऊपर से बैठ के ये पोर्टल को देख रहे हैं?
ये जो पोर्टल पर बैठे हैं या तो जैसे डिस्ट्रिक्ट इम्यूनाइजेशन ऑफिसर है जिनका नंबर आपको दिया है ना. मैं यहाँ पे CHC का इंचार्ज हूँ, तो वो पूरा गौतम बुद्ध नगर के इंचार्ज है.
Bipasha was not the only one facing this problem of having confirmed slots, but their records not showing up at the vaccine center.
We have been told that our name is not there in the list. That's the reason why we have been turned back. So I don't know what kind of management this is, but there is no communication, there is nothing.
Although we have that 4-digit PIN also, but they are not ready to give us the vaccination. They are saying that they will the vaccination will be thrown away, but they will not administer because the list is not there in their center. Also have it on camera and I'll record.
The vaccine officer said they had 19 vaccine shots left for the day, but they can't administer the dose to anybody, even with valid appointment letters, because of the discrepancy in the appointment schedule.
Welcome back, viewers. You're watching a COVID Dispatch as we continue to document grief, which is, it doesn't seem to have any ebbings where this country is concerned, where the COVID crisis is at play. But as we document grief, we must document hope, and this is a story of hope. It's about one individual who was tested positive for coronavirus on the 12th of April. He went through hell, but he came back to tell his story. This is the story of Saurabh Bhardwaj, Aam Aadmi Party MLA. This is the story of Aam Aadmi Party MLA Saurabh Bhardwaj. 41 years old, Saurabh represents the Greater Kailash constituency and lives there with his wife and a 7-year-old daughter. Saurabh Bhardwaj tested COVID positive on the 12th of April. Soon, he was fighting for his life in an ICU. This is his story to hell and back. Saurabh Bhardwaj, MLA Aam Aadmi Party, you've been battling the COVID virus like very few have. Would you think this journey, Saurabh, jo aapki ye journey hai, do you think it's, you pretty much went to hell and you've walked right back?
Yes, in a way you can say it, that I didn't expect that I'll get so sick. When my daughter developed symptoms after 2 days, we were sure
How
that
old is your daughter, Saurabh?
My daughter is 7 years. So we were sure that she has COVID. But because, she's a 7-year-old daughter and we have been living with her only. We cannot isolate, you cannot isolate your kid. Ki tum mask pehno, tum us kamre mein raho. She's too young, She sleeps with her mother. She's always with her mother. Yeah. So we thought that, now she has COVID and we will get COVID. And so I took her in my lap, I took her to the hospital for her test and all. And she tested positive and we were very okay that we will get COVID and we will recover in 4-5 days with mild fever or some, some cold cough. So she recovered in 2 days. My daughter recovered in 2-3 days. And I got symptoms after 2 days. But the problem was that, this fever was continuing for 5 days. And I had
Your
severe
wife
body
also
pain.
tested positive, Saurabh?
Yes, my wife also tested positive. But her symptoms were not as intense as mine. Like she used to get fever of 100 or 101. But my fever was, touching 103, 104. And I had severe body pain. I had a vomitish feeling whole day. Very intense kind of a headache, which will not go. That headache will continue for days. So after 4-5 days, Atishi, I was in touch with Atishi. My wife was in touch with Atishi. So she was, constantly telling Atishi कि I think we should get him admitted. And Atishi had been calling me every day कि तुम admit हो जाओ. So I thought, let me go to the hospital. At least वो test हो जाएंगे वहीं पे सारे और reports आ जाएंगी. So I went to the hospital. I went in an ambulance because मतलब positive patient cannot go like in a cab or something. So I was feeling very amused.
You went alone, Saurabh?
I went alone. And I was feeling very amused at why am I going in an ambulance, because I'm not the one कि मतलब कि मेरी लेटने वाली कोई हालत नहीं थी. मतलब I was okay. I still considered myself healthy at that time. तो मैं एम्बुलेंस में गया, बैठ के गया. वो बोले कि लेट जाओ. मैंने कहा नहीं लेटने वाली हालत नहीं है, मैं तो आराम से चला जाऊंगा. So I went to the hospital, got myself tested, CT scan वगैरह हुआ. तो my CT scan was bad, and my blood reports were also bad.
What was your score? What was your score, Saurabh, of your CT?
I think it was very high. I don't know the scores and all, but doctor said it is bad. And there are there is something called inflammatory indicators. Blood के अंदर inflammatory indicators होते हैं, which tell you about the kind of infection you are facing. So they were also very bad. D-dimer वगैरह जो था वो सब बहुत खराब था. And they said कि आप यहाँ पे admit हो जाओ, हम आपको 2-3 दिन रखना चाहते हैं ऑब्जर्वेशन में. फिर शाम से मेरा ना ऑक्सीजन लेवल गिरने लग गया हॉस्पिटल के अंदर. इट फेल टू 80. सो उन्होंने मेरे को 2 लीटर ऑक्सीजन पे लगाया, बट ऑक्सीजन लेवल मेरा उठ नहीं रहा था. तो ऐसे ऐसे करके वो 14 लीटर ऑक्सीजन तक पे मेरे को रखा, बट मैं ऑक्सीजन वॉज नॉट पिकिंग. मतलब मेरा सैचुरेशन लेवल नहीं आ रहा था, 90s में नहीं आ रहा था, वो 80s में ही टिका हुआ था. सो
Even after 14 liters of oxygen?
हाँ. So they got, मतलब मुझे लग रहा है फिर वहाँ पे पैनिक हो गया इसको लेके. And probably my wife called, कई सारे लोगों को she called up कि वो बहुत सीरियस हो गया, ये है वो है. तो I could see that panic happening in hospital also. Doctors ये वो. So they said कि नहीं, I think we have to shift him to the ICU. So they shifted me to ICU. And ICU was altogether a very strange experience for me. मतलब ICU अलग चीज है बिल्कुल, because ICU is like 24 hours, lights are on, there is always a commotion happening because nurses and all, they're always attending someone, and your beds are very near to each other. They are just separated by a curtain. So basically you get to know about at least 5 to 6 patients around you कि उनके साथ क्या क्या हो रहा है. And you have a lot of probes on your body which are continuously monitoring your pulse, your BP, and your saturation level. Yes. And there's a nurse who is sitting there.
There's constantly that beeping sound also of all the beds.
And that beeping sound is, it is...
Yeah.
It sounds very dangerous, especially to a person who is lying on the bed and struggling for oxygen. That beeping sound, creates a lot of stress, creates a lot of mental confusion in you. And I think when you are under severe corona, there are a lot of mental delusions also happening. Your brain goes in a state of a trance. You start imagining a lot of things. And because I had my phone with me, so it was the time when I was reading all the news about oxygen is not there in hospitals. There are SOS calls going across India for oxygen. So I was feeling so, stressed कि ये क्या.
But Saurabh, I saw that video of yours.
Right.
वो जो video आपने एक जो video दिया था वो देखा था मैंने.
Right. Yes. So that video happened, 2 दिन से WhatsApp group था हमारा. We have a WhatsApp group of our leadership. Government leadership है उसमें, party leadership है. where we were discussing कि इस hospital में नहीं है तुम करो, इस hospital में there is a SOS call, help them. And then I saw that there is a SOS call from my hospital where I am admitted, saying that they just have 3 liters, 3 hours of oxygen left. And I felt this is so sad that, you know, different governments at the level of center, state, they're simply, you know, fighting their petty battles. While this problem is huge, you know, this problem is big. And I think at this time, at least, you know, there should be no leg pulling. There should be total coordination. We should at least leave politics aside during these times, during these times of national emergency.
मतलब इस पूरे दौरान में कभी was there a thing that you might have to get onto the ventilator?
नहीं, वेंटिलेटर वाली सिचुएशन नहीं आई. जब मैं हाईएस्ट लेवल ऑफ ऑक्सीजन पे था तब ना एक बड़ी साधारण सी चीज है. आई थिंक इट्स सच अ सिंपल थिंग which I didn't believe it will work, but it works. It is like, you know, if you are facing lack of oxygen in your body, you are on oxygen or you don't have oxygen resource, just lie upside down. आप अपने पेट के बल अपने चेस्ट के ऊपर लेट जाइए, उल्टा लेट जाइए. Proning, हाँ, आप उल्टा लेट जाइए. So I could see it because I was on a constant monitoring thing and I could always see my SpO2. So the moment I'll turn down on my chest, मेरा SpO2 87 होता था तो 97 चला जाता था. 10 पॉइंट का फर्क आ जाता था. और फिर मैं in my 24 hours of day 16 घंटे में उल्टा लेटा रहता था. तो मेरा SpO2 जो है ना अच्छा रहता था. And in ICU, you know, you'll get a lot of strange things. For example, I could hear one of the ladies who is just next to me, but because there is a curtain, I don't know her. I haven't seen her, but I could always hear her voice for 1.5 days. You know, she's talking to nurses. Nurses are telling her to do something. Doctor comes and talks to her son. She's like this and she's like this. And one day, when I get to hear कि अरे 69 वाली बॉडी हटा दो, दूसरा पेशेंट वेट कर रहा है, बॉडी हटाओ. And it's such a shock that, you know, I've been hearing her and now she's a body. And I was thinking these nurses and doctors should probably use another term for a dead body, because everybody in that ICU gets to hear when nurses say कि अरे वो dead body हटाओ, वहाँ पे 69 पे dead body है, अभी तक क्यों नहीं हटाया. And it is not a very pleasant feeling. You feel really bad thinking that, you know, person who was just next to you died and he is now, or he or she is now a dead body. So, and another thing which I felt was these doctors, nurses, ward boys, they are doing a huge act of bravery. It's not just service, it's bravery. साहस का काम है जो ये लोग कर रहे हैं. When I used to, you know, when my doctor used to visit me, I couldn't see them because they were all in PPE kits, wearing their masks and their face shield, all kinds of things with their gloves and all. But from their voice and from their body posture, I could understand that this doctor is quite senior. I think his name was Dr. Chatterjee, and he is probably, you know, 65 plus. So for a person who is 65 plus, he is visiting my ICU where there are all serious patients, you know, who are heavily infected with corona, and they're coughing because patients don't use masks. We are coughing, spitting, and we are doing everything there in that ICU. So you can imagine the kind of viral load you have in the ICUs.
Yeah.
And in such heavy viral load environment, this doctor who is 60, 65, who has kids at home, who has responsibilities, who is equally vulnerable, they are visiting ICUs, talking to the patients, recommending them medicines. And the same goes for nurses, you know. Nurses sit in that ICU for 8 hours, 12 hours. They are breathing in the same air. I think it's a huge act of bravery. And we as a society owe so much to all this medical and paramedical staff. Although before I got sick also, I used to feel, yes, they are doing a big job, you know, they are doing a great job. But after coming from hospitals and ICU, the kind of patience level they have, the kind of empathy they have for the patients, I think it is unimaginable. And we as a nation, we as a society owe a lot to this community.
Saurabh, what was your weakest moment? Did you ever reach a
Okay.
point where you thought this was my weakest moment?
Preeti, one thing I was pretty sure, I don't know why there was always a confidence. I never thought that I'll die. When I was in ICU, I got to the maid who used to work with us, who we got admitted at one of the hospitals in ICU. We arranged plasma for her. She died. So that day, that sound of ICU and that, that lights of ICU. So there was an illusion which got created in my mind while I was in a kind of a trance that this voice, there is a huge fire burning and there is a Yamraj who is roaming around and he's simply, picking up people and putting them in fire. He's picking up people, putting them in fire. It was like, Yamraj is just roaming around and he's very angry with us. He's very angry with us and Indians. God is very angry with us as Indians. And he's saying, now I'll pick up people I want. And he's simply picking. And I could see those faces, like, that volunteer of ours, that maid of us, that, he picked that volunteer of ours and he pushed him in the fire. He picked our maid, pushed her in the fire. And that was I think it was a very weak moment for me. And it was a illusion which was getting created in my mind.
Right.
And although, in a way, I knew that this is an illusion, but I knew that, this is something which is happening around us. Because those lights and all, they create an illusion of fire.
Yeah. I'm sure the path to recovery is still on. You must be strengthening your lungs. All of that, it's an ongoing process. But you're well and we wish you well.
Thank you.
And thank you, Saurabh. I really appreciate you taking this time off and joining us right now because, like I said, you're still recovering. But thank you so much. And we wish you lots of health and lots of love to your family. Thank you.
Thank you.
Thank you, Saurabh. With that, viewers, it's a wrap on this edition of COVID Dispatch. We're going to continue to roll out of the state of Uttar Pradesh, bringing you the stories that matter most as the second wave of coronavirus sweeps across the state. Thank you for watching. Up next is Rahul Kanpur.